Trudy Mason sitting in for Aaron and welcoming to the show now a doctor, a podcaster who says it is absolutely vital for doctors to start talking to each other about professional burnout and the toll it can take. Dr. Stephen Palanchuck, welcome to CJ 8800.
Thanks, Trudy.
You're a specialist in internal medicine, Dr. Palanchuck. How long have you been practicing?
I've been a specialist in internal medicine for 7 years now.
And you are coming to the question of professional burnout from a position of experience. What has your experience been with professional burnout?
Well, it first started during the COVID pandemic. As a lot of caregivers, it was my first burnout back then because I was very much implicated in developing the protocols to take care of the COVID patients. And there was this kind of excessive engagement that I gave, and I had my first burnout back then. And years after that, I lost two doctors in my hospital from suicide. And I was not feeling that good myself back then, and I really told myself, well, that could have been me.
That must have been very sobering to realize that that could have been your fate.
Yeah, yes, really. And I started to think, like, what could we do differently to have different results? And because we cannot really get prepared for caring for people, really, and to being exposed to human suffering. And I say we have some batteries of empathy sometimes, and it's called the compassion fatigue. And it's something that comes very, very slowly. You don't even realize at first that it's coming to you. And then eventually, when you lose people around you and you're asking yourself, well, what's the purpose of all this? Like, what's my goal here? What's my, how can you make sense of something this senseless, basically?
Your podcast is called Healing Until We Break. Why is it that doctors seem driven not to acknowledge their own personal struggles, their own personal mental health struggles, until the point where they break and it becomes obvious they can't go on?
Yeah, well, there are a lot of reasons. I think the main reason is cultural. And first of all, there's this excessive engagement that I was talking about, this culture of the sacrifice that's, I would say, even glorified. Like during the residency, we worked so many hours without even counting, and we even like brag about it in between colleagues that, how many hours did you sleep? Oh, I slept this much hours. And it was a good thing back then to impress the doctors, our teachers. And there's also this myth of being unbreakable as a caregiver. And as if you are a caregiver, you cannot be a patient. And I've seen pregnant doctors many times in my hospital working, being sick with the flu, and sometimes even coming with an IV stuck in their arm and still being there. And we're all thinking that it's normal. But if we had a patient coming to us in the office and telling us all of this, well, we would say, well, that's crazy. But we do accept it when it comes to us. And the last reason is, I think, the stigmatization of the mental health issues. The one we have in ourselves, but the one we have also in between colleagues sometimes.
Oh, that's interesting. Have you had colleagues like that? Have you found that stigma around you?
Well, it's not, I don't think that people want to do harm. It's mainly basically the reason is that the way it's organized, the medical practice, if I am sick and I have to take a leave of absence, then my colleagues will have to see the patient. Someone has to be on call. There's not less patients to see. There's not less days in a year. So it's like this pie that we have to share, and to share this burden. If I'm not there, then I know that my colleagues will have to take the job. And so there's also this kind of culpability, I think, that comes with it. So you stick around and you try to do your best, because you know that everyone is doing their best, and I think nobody's lazy, and we see that it's very difficult sometimes for some colleagues.
We have a government, too, that is encouraging doctors to do more. This has been a major theme from the CAQ government, actually coming right out and saying doctors have to take on more patients. They have to do more. They have to, to clear the backlogs and so on. That doesn't seem to me very helpful in a situation where you may be dealing with doctors who are on the edge and close to burnout.
That's very true, and I think that the doctors are giving more than they're capable of, and hearing this, on the media sometimes being called lazy, and some say that you work part-time because in the eyes of the government you work 3 days a week because you only bill 3 days on the public healthcare system. But sometimes we are also teachers. We do other things than actual direct care to the patients, and sometimes we have to also acknowledge that we have more women in the profession, and those women, they have even more pressure than us sometimes, because they have to take care of their families, and the pressure is on, and sometimes they have children with special needs that they have to attend to. So I think that if we would be giving more freedom to people to manage their own schedule, and I think people would be more willing to give up time, because we love our job, we love our patients, and we want to keep going and doing this with the humanity and heart that it takes to do this job for a long time.
Dr. Palanchuck, you're breaking the silence with your podcast, Healing Until We Break. Are you getting any feedback indicating it's making a difference?
It more and more, yes. And I'm having a lot of caregivers, and it's not only for doctors, the podcast, it's for all people doing, working in healthcare and caregiving. And I'm receiving a lot of anonymous messages thanking me for opening up. And I think one of the things that's making this very difficult for everyone is the isolation that we feel, and sometimes even the shame, I would say, in having those feelings. And I think that the goal of the College of Physicians of Quebec is to protect the public. The first mission is the public's protection. But I would say that if we want to protect the public, then we have to take care of the caregivers. And if we shame them into not seeking help, then I don't think this is helping the care of the public.
Dr. Stephen Palanchuck, thanks very much for the interview.
Well, you're welcome.
Dr. Palanchuck is a specialist in internal medicine, and his podcast is called Healing Until We Break.